There's no doubt what's in there. Now this, not too sure. You guys play today?
Yes. We go to Cardioselective.
Okay.
So not conference, but we're playing.
That's why I had to leave really early. Evan told me they'd probably be in class, and then Thursday said we have to leave before 8 home.
Yeah, I think their game got up.
That's what he said. They're at Huntington, I think.
Yeah. I don't know.
Yeah.
I know it's hard.
Yeah, he was bummed. He said, I like coming to class. I don't want to not come to class, but coach says, go, you have to go. Okay. Starting back here today.
Yeah. Okay. I was like, what?
Are there any more quizzes out? Okay. I'm going to try the document camera today in the hopes that the baseball players who have to watch this later on will be able to see what I might have otherwise written on the board. So today we're going to discuss beta blockers. And the subtitle here, as you can see, is what are they good for? So when we start to talk about beta blockers, they're going to antagonize these beta adrenergic receptors. So they'll prevent the activity of these neurotransmitters, norepinephrine, and to a lesser degree, epinephrine, on these various receptors. So they're so-called sympatholytic drugs. Sympatholytic drugs. To explain what I mean by that, let's go to the little makeshift blackboard that I have here with the document camera, provided my bloody computer gets its coffee and wakes up properly. All right, so yeah, the sun coming over, that doesn't help, does it? Okay, can you see my finger? Okay, let's try this, see if it works. I don't make any promises, especially when it comes to my artwork, but we'll try. Okay, so when we talk about a sympatholytic, so if this, let's say this is the brain. And then this is the spinal cord here. So very good. Now this would constitute the central nervous system. Now at the base of the brain, we have the hypothalamus. Let's just stick the hypothalamus kind of here. The hypothalamus is a paired structure, but I'm just drawing it here. This is not meant for anatomical accuracy. This is just meant to give you a perspective. So this is the hypothalamus. And the hypothalamus has these, maybe I should back up just to make sure we are all completely on the same page. So the nervous system is divided, NS, nervous system. So it's divided into the central nervous system, that's the brain and the spinal cord, and then the peripheral nervous system. And the peripheral nervous system controls the voluntary movement of skeletal muscles and also the involuntary movement of glands and things like that. So the peripheral nervous system is broken into the so-called somatic nervous system. And the somatic nervous system will control voluntary movement of skeletal muscles. Can you see that okay, or does that glare really affect it? No, it's fine? Okay. Boy, the baseball team better appreciate this. So voluntary movement, and when you hear voluntary movement, think skeletal muscles, which I'm just going to do like that. Now, the second component will be the autonomic nervous system. When you hear autonomic, think automatic. Automatic. Think about all the things you don't have to consciously control. So if it's automatic, it's controlled by the autonomic nervous system. And the autonomic nervous system is divided into two branches, a sympathetic and a parasympathetic nervous system. Well, branch of the autonomic nervous system. So the sympathetic nervous system is associated with the so-called fight or flight response. So let's say that you're running from a velociraptor. You're running as fast as you can, or you decide to turn and fight, which, by the way, would be a stupid idea. But those two responses are going to be essentially mediated by the sympathetic nervous system. Increased heart rate, dilation of the pupils of the eyes, bronchodilation of the airways, fast release of glucose for quick energy. All those things are essentially mediated by the sympathetic nervous system. Whereas the parasympathetic nervous system, that's going to be the rest and digest. Rest and digest response. My R's are suffering there. So this would be a slower heart rate, increased blood flow to the GI tract, increased GI motility. Things like that will be associated with the activation of the parasympathetic nervous system. Very good. Are we all on the same page now about the nervous system? Okay, let's focus now, take our magnifying glass out, focus on the sympathetic nervous system. And now we're going to go back to my very ugly drawing here. Okay, so here we have the central nervous system with the brain and the spinal cord. And at the base of the forebrain, the prosencephalon, we have the hypothalamus. So the hypothalamus has these really long axons, and they go all the way down to the thoracic and the lumbar portion of the spinal cord, and so on and so forth. And these are then going to synapse with preganglionic cell bodies that are in the spinal cord. So let's make those in, oh, you can't see that, can you? You can? Yeah, okay. So these are meant to be preganglionic cell bodies. Those preganglionic cell bodies are then going to have relatively short axons. I'll draw their axons in blue. And they are going to synapse in groups of ganglia that are going to be connected on either side of the spinal cord. These are called paravertebral bodies. So these are the preganglionic, preganglionic neurons. The sympathetic nervous system always has two neurons that go to the target. You have the neuron that innervates the target, that's called a postganglionic neuron, and then a neuron that synapses with the postganglionic neuron that is itself synapsed with the central nervous system, called a preganglionic neuron. And the preganglionic neuron has its cell body in the central nervous system. So these then are going to synapse with your postganglionic neurons. I'll put those in, well, no, let's put those in blue. And then these blue ones, they're going to innervate, you know, whatever they innervate, and so on and so forth. These postganglionic neurons they're going to release norepinephrine mainly, and to a lesser degree, epinephrine. And that norepinephrine and epinephrine is going to bind two different groups of receptors. So these receptors are called adrenergic receptors because norepinephrine is called noradrenaline. And then epinephrine is called adrenaline. Okay, so because of that, these are called adrenergic, adrenaline, adrenergic. There's two classes of these adrenergic receptors. There's alpha and beta. Alpha and beta. Now, I realize some of you have had this before, but a little review doesn't hurt. Now, what kind of response will you get from these targets? Depends on the receptor. Because remember all those signal transduction pathways I tortured you with at the beginning of the semester? They're those different signal transduction pathways are hooked to these different receptors. So these different receptors, even though they're being bound by the same neurotransmitter, can elicit different cellular responses in the target tissue. So let's look at some of these responses. So we'll look at alphas. There are two subtypes of alpha receptors. There's an alpha 1 and an alpha 2. An alpha 1 and an alpha 2. And we looked at alpha blockers. So your alpha 1s, they are found in peripheral blood vessels predominantly. And they're also found in the wall of the bladder. And in males are also found in the prostate. Those are your alpha 1s. Your alpha 2s are found in the central nervous system. Central nervous system only. They're not found in the peripheral nervous system. All right, let's do the betas in a different color. So beta 1s, those are found essentially in the heart. But they're also found in the kidney. And activation of beta 1 receptors causes the heart to beat faster and contract more forcefully. Activation of beta 1 receptors causes the heart to contract faster and more forcefully. What about your beta 2s? Beta 2s have a really wide range of activities. Let's look at what beta 2s do. So beta 2s are found in the smooth muscle cells, in the walls of blood vessels that supply things like skeletal muscle and the brain. And if you activate these particular vessels, you're going to get vasodilation. They're also found in the smooth muscle that surrounds bronchial tubes. And activation of these beta 2 receptors causes bronchodilation, so you breathe more easily. And then beta 2 receptors are also found in the GI tract. And if they're activated, they will decrease motility and slow digestion. Then they're also found in the ciliary body of the eyes. And if they're activated, they increase secretion of aqueous humor. You know what aqueous humor is? Who doesn't know what aqueous humor is? Okay, so the eye, aqueous humor. Okay, aqueous humor is not a comedy routine. If you look at the, cornea of the eye, optic nerve, then you have the lens. Okay, and then you have the ciliary body here and here. Ciliary body is here and here. So this has the ciliary muscles. This is connected by suspensor ligaments. So go ahead, put your writing implement in front of you. Focus on it. Now focus on the wall. Focus on your writing implement. Focus on the wall. Were they both in focus at the same time? No, that's called accommodation. That's called accommodation, and it is mediated by the contraction of these ciliary muscles. That's due to your ocular motor nerve. That's one of the reasons why, if you have a head injury, your neurologist or maybe the nurse will say, okay, keeping your head still, follow my, head still, follow my finger, follow my finger. Dang, you're good. And that way, because there's at least 4 different cranial nerves associated with the movement of the eye. And if you're swelling in the brain anywhere, Jessie shouldn't be able to do this. She should get stuck actually in places like that. Or if you have multiple sclerosis and we have you do this, the eye will actually start to twitch, do this. That's called nystagmus. Anyway, the other thing the ciliary body does is it releases this fluid that fills the anterior chamber. That's called aqueous humor. And humor in old English, well, Latin, humor had to do with fluid, bodily fluids. And our term humor actually means when something was funny, it was thought it was funny because fluids change location in your body. That's where we get our term humorous. So aqueous humor is this fluid here, and if you stimulate these beta-2 receptors, you get more aqueous humor in the anterior chamber of the eye. And then in the liver, your beta-2s are going to, when they're activated, the liver will release glucose because it'll degrade its glycogen stores. So that will raise your blood glucose levels. And then the pancreas also has beta-2 receptors. And when it is stimulated, it will release the hormone glucagon. And what does glucagon do? Among other things, causes the release of glycogen stores in the liver. So these two work together. They're simpatico. Finally, last one, I promise. These beta-2s are very busy. On the surface of blood vessels, endothelial cells, there's an enzyme called LPL, which stands for lipoprotein lipase. And lipoprotein lipase breaks down fats that are in your blood, and it makes free fatty acids that are then taken up by these cells. So when this is stimulated, this breaks down fats. Let's say breaks down fats in serum. Now, why did I go through and rehearse the litany of all the things these receptors do? For one very important reason. If you know these functions, then you know the side effects immediately that occur when you inhibit these receptors. Okay, so let's introduce to you the beta blockers then. Beta blockers come in 3 types. Non-selective, cardioselective, and then those that also have a vascular function. So vascular function added. So let's start with the non-selectives first. So these will inhibit both beta 1 and beta 2 receptors. These, as we said before, what's your mnemonic for these? New Zealand, because they start with N to Z, New Zealand. And if New Zealand is too hard to remember, just think of a cute little kiwi. Because the kiwi is a symbol for New Zealand, right? I think on New Zealand Airlines, they have a kiwi on the side of the plane. So again, whatever helps you remember stuff, I'm all down with that, sincerely. If taping a little kiwi to your mirror in the morning helps you remember this, do it. Do it. So let's introduce you to some of the drugs. And you have in your handouts a table of the beta blockers. It's on page 40. Page 40. Starts on page 40. And it gives you a list of these different types of beta blockers. Okay, the first of these is propranolol. Now, a word about the beta blockers. They all end in OLOL. So these drugs are no laughing matter because they end with laughing out loud. So remember, high blood pressure is no laughing matter. And to treat it, you use the drugs that end in LOL, propranolol. Sorry, I left out an R, propranolol. Now, propranolol is one of the most heavily used out of this group. This drug is let's try one that actually works. This drug is lipid soluble. So it crosses the blood-brain barrier. And remember, one of the things that beta 2 receptors do is they vasodilate vessels that provide blood to the brain. So this drug is used to treat migraine. And it's effective for the treatment of migraines in many people. Other members of this group include timolol, nadolol, sotalol, sotalol is unusual because it's also a type 3 antiarrhythmic. When we get to the antiarrhythmics, I'll tell you more about sotalol. A stupid way to remember sotalol is a boy on stilts. A boy on stilts says, I'm so tall. Sotalol, I'm so tall. Okay, it's close. Okay, Katya's back there ready to fall off her chair saying you are so dumb. But Katya, if it helps you remember it. See, you'll never forget it now because it's so dumb. You're good, okay. Okay, Corinne's not impressed, but that's okay. Corinne, you'll learn to appreciate it. I'm so tall, sotalol. It is a type 3 antiarrhythmic, as well as being a beta blocker, and then pindolol. Pindolol. Now, pindolol is, I put that in a different color because that's unusual. Instead of being a beta 1 and beta 2 antagonist, this one is actually a partial agonist. So instead of blocking these receptors, it gets in the way of norepinephrine and epinephrine, but it activates the receptors just a little bit. So this has so-called intrinsic sympathomimetic activity, which is mercifully abbreviated ISA. Intrinsic sympathomimetic, and that marker has seen better days, activity, or ISA. Pindolol has ISA. There's another one that does too, acetobutolol. We'll get to that one. So pindolol is one of these partial agonists. All right, now, again, we're asking the question, beta blockers, what are they good for? So because they, yeah, Josh?
All of those we just mentioned, those are all lipid soluble?
No, just propranolol. And some of the side effects I'm going to talk about are a consequence of them crossing the blood-brain barrier. So those will only really apply to propranolol. So first thing they're going to do is they're going to lower blood pressure. And how do they lower blood pressure? They lower blood pressure because they decrease the heart rate. They can cause bradycardia. That's a D. So they lower cardiac output. So these are drugs you can use to treat hypertension. Now, the other thing that these drugs do is because they block beta 1 receptors in the kidney, they also decrease the production of renin. Learn how to spell. Because they decrease renin production, they'll drop the blood pressure even more. So these drugs drop blood pressure substantially. Now, the other thing you can use these drugs for, because they lower cardiac output, they're going to lower cardiac oxygen demands. And I hope this makes intuitive sense to you. A heart that's beating neither as fast nor as vigorously doesn't require as much oxygen. Now, what advantage is that? Well, a heart that is ischemic causes substernal chest pain. That's called angina pectoris. This is usually due to plugged coronary arteries, and beta blockers are very good for treating angina pectoris as well. So they're good for hypertension. They're good for angina pectoris. And another indication for these also is congestive heart failure. Now, I must say that their use in congestive heart failure is controversial. the little star. Controversial because sometimes beta blockers can actually worsen. So that's something to keep in mind with congestive heart failure. Now, one thing beta blockers are very good for, and so that is a indication. Next one is thyroid storm. Thyroid storm is usually something that happens as a result of hyperthyroidism. In the case of severe hyperthyroidism, you not only have more thyroid hormone being produced, but the body becomes more sensitive to it. So the heart rate goes up very, very high, dangerously high, and the blood pressure gets dangerously high. So beta blockers are definitely first line indication for thyroid storm. Finally, timolol, when used in the eye, can be used to treat glaucoma. And that's usually timolol. That should make sense. Beta 2 receptors, when they're activated, increase aqueous humor production. Glaucoma is caused by increased intraocular pressure in the anterior chamber of the eye. When the pressure in this anterior chamber gets to be too high, this pressure now can start to put pressure here and then put pressure on the optic nerve that can cause a condition called papilledema. This is very dangerous. This pressure on the optic nerve can start to kill ganglion cells and start to kill some of the axons that the ganglion cells make to form the optic nerve. You can go blind in this case. Optical timolol can decrease aqueous humor production by the ciliary body. And timolol is not the only one that's used for glaucoma. There's another one called cartiolol that's also used for glaucoma. All right, so those are the indications. Now let's talk about the side effects. Given what we know about these drug side effects, really are going to kind of fall out from what you'd expect. So the first side effect, so we're going to say adverse effects. So the first side effect of these is that they can cause hypotension. And bradycardia. This hypotension and bradycardia can be a definite concern in some people. Secondly, at least in the case of propranolol, you can have things like depression and insomnia and even nightmares. Now, this will be usually the case with propranolol. And that's due to the fact that it crosses the blood-brain barrier and may have these effects in the central nervous system. Now, because they inhibit beta-2 receptors in the respiratory tract, they can cause wheezing and shortness of breath. Therefore, they're contraindicated in cases of chronic obstructive pulmonary disease. They're also contraindicated in the case of asthma for this very reason right here. Fourthly, they can cause blood lipid levels to increase because they inhibit the lipoprotein lipase. So they can have rather undesirable effects on blood lipid panels. Now, what do they do in the GI tract? What do beta-2 receptors do in the GI tract? They slow down digestion. So if you inhibit them, what do you think happens? Diarrhea is a feature that at least some people experience with non-selective beta blockers. Fourthly, they can cause hypoglycemia. Now, in non-diabetics, this tends to be just a slight dip in the blood sugar, but if you're diabetic, this dip can be substantial. Secondly, because hypoglycemia tends to manifest with increased heart rate, beta blockers will prevent that from happening. So they can essentially, they can mask the effects of hypoglycemia in diabetics. So if you use these drugs at all in diabetics, you have to use them with tremendous caution. Okay, questions about those side effects? Once you know what the beta-2 receptors do, the side effects just kind of fall right into your lap. Okay, now let's look at the second class of beta blockers, and those are the cardioselective. What's our mnemonic for the cardioselectives? Armadillo, because they start with A through M. A through M. So this includes drugs like atenolol, metoprolol, bisoprolol, esmolol, and acebutolol, And acebutolol, like pindolol, has intrinsic sympathomimetic activity. It is a partial agonist, like pindolol. Now, why are these cardioselective? Because their affinity for the beta-1 receptor is much greater than their affinity for the beta-2 receptor. So these are cardioselective in that they will primarily antagonize the beta-1 receptor. They will only antagonize the beta-2 receptor at high doses, doses that are well outside the therapeutic doses that are approved for their use. And again, notice their first letter starts with between A and M, hence our mnemonic armadillo, so New Zealand, or kiwi and armadillo. Isn't there a school that has an armadillo as a mascot? Okay, I can't remember. Maybe I was imagining it. So, what are these good for? Well, they're good for hypertension, they're good for thyroid storms, and they're also good for congestive heart failure. Again, there's some controversy here, but two of these drugs, in particular metoprolol and bisoprolol, have been shown in several clinical studies to benefit patients with congestive heart failure without making it worse. So these have a good track record. These are used, and there's little controversy about these. There's more controversy about others, but these have a very good track record. Now, with these, they are safe for patients with asthma. Why might they be safe for patients with asthma? They don't inhibit beta-2s at normal dosages. So your lungs are usually fine with them. Now, some people are very sensitive. They have so-called high irritability of the bronchi, and even a beta-1 specific beta blocker might cause them to wheeze. In cases like that, then you would usually take them off the drug. But on the average, these drugs are safe for people with asthma. They're also safe for diabetics. Having said that, you want to make sure these patients are monitored. Simply because certain drug-drug interactions can raise the concentration of these drugs in the blood sometimes. All right, any questions about the second group? Now let's do the third group. So, I'm sorry? My camera turned off. Why did it do that? Okay. Come on, you. Come on, computer. Ah. I don't know what, the Zoom just really chews up the RAM on these, and it makes this thing work so very slowly. Yes, I went, okay, there we are. Okay, third generation. Third generation, there are two drugs only. There's labetalol, and carvedilol. These inhibit beta 1, but they also inhibit alpha 1. So they cause vasodilation. So what are these good for? These are good for congestive heart failure. And these drugs are drugs of choice for congestive heart failure because they decrease the load on the heart, they slow the heart down and decrease the load, and they preserve the heart and prevent remodeling. Now, a word about labetalol. Labetalol is also very heavily used in women who are pregnant. It is safe for pregnancy and for chronic hypertension in women who become pregnant. This is your drug of choice. Methyl-dopa would be used if they have mild hypertension and they didn't have hypertension before their pregnancy. Other issue with labetalol is there is an IV form of labetalol that's used in hospitals for hypertensive emergencies. Very effective for hypertensive emergencies. Now these will have many of the same side effects as the cardioselectives, except with this, you're also going to have orthostatic hypotension because of the vasodilation. Okay, looks like it's time. Okay, we got through the beta blockers. Have a great weekend. I will see you Monday, and we'll look at the clinical use of these antihypertensives. Put it right there. Yeah.
I have a question.
Yeah.
So I just got a job at CSL Plasma